Communities to Careers has started to systematically break down barriers. I see the hope in the students' eyes when I come and I tell them my background, and they start to identify with a physician who's talking to them in a very welcoming environment.
That is the primary goal of these programs, is to have students from small communities participate in these programs and come out as providers and then go back to their communities.
What inspired me to become a pediatrician was really a lot of life experiences early on. I myself, as a sufferer from asthma, often received delayed care for my asthma because my mom's predominant Spanish-speaking abilities. And a lot of the physicians who took care of me didn't speak Spanish. So my asthma went untreated for several years until I was able to develop my own voice, and my English was actually a lot stronger. That's what actually got me started thinking about medicine.
It's very important to have diversity in healthcare. Whenever people see my name, Dr. Garcia, or they see that I'm a female, I'm Hispanic, they feel more comfortable coming to see me. They feel like their healthcare needs are going to be met.
Having Dr. Garcia as part of our team within our community, she is one of our providers that always has a full schedule. I mean, her patients are dedicated to coming to see her. So knowing that she was going to be coming to our Clovis location, we just knew we have such a great need here. And every day we have positive outcomes. We save lives. We help maintain.
After applying to the program and gaining acceptance as a participant, I was assigned to Dr. Erica Garcia in Portales, New Mexico. And that was the first time that I was able to meet a Hispanic woman as a physician. And it really opened my eyes to the possibility of becoming a woman provider in my home community and what that could look like.
She reminded me a lot of myself, that hunger to succeed, that hunger to become a physician. It's not easy just to get into medical school on your first try. And so she had her struggles, but in the end, she succeeded, and now I can see her do something similar like myself and start practicing in a small community, and then giving back to her community and giving back to the students who she will be able to precept in the future.
It's difficult to find somebody to shadow when no one in your family is a physician. It's difficult to ask questions about careers when no one in your family is a pharmacist. Communities to Careers helps to break down those barriers by giving students access and allowing students and encouraging students to ask those questions. I volunteer my time on purpose within the Health Careers Academy and other programs to motivate these students, because they will be my physicians, they will be my children's physicians, and I invest time in them because they are the future healthcare workforce of New Mexico.
So I think with not just providers, but with nurses, medical assistants, it's very critical to have someone who can represent the Hispanic population.
As a future physician, I can't wait to participate with the University of New Mexico Office of Diversity, Equity, and Inclusion as a mentor if possible. I would love to take any students under my wing, just as Dr. Garcia and Dr. Arguello took me under their wing as a student, and share all of my experiences so that students who are interested in the healthcare field could learn from me and my experiences, and I could help guide them just as I have been guided throughout my participation in the programs.
I am a true advocate for these programs. I believe that they work 100%. I really hope that the funding is there for expansion in New Mexico, especially here in Clovis, Eastern New Mexico. I am very thankful that I had the experiences that I did and all the networking that I did. It helped me in the past and it helps me now, and I know that it's going to continue to help me in the future. I am looking forward to continuing this path for other students, and as long as I can, continue to advocate for the pipeline programs.
Communities to Careers was able to plant a seed, and it grew, and now I'm a full physician here giving back and hopefully planting seeds of my own.